The seventh chapter of the report focuses on intimate relationships. In particular, it discusses the issue of child abuse, family-based violence, family relationships, fertility, and sex. Concerns about rises in child abuse and domestic violence are in general supported and validated by the empirical data. There is a lively debate in the academic literature about how much it increased, in which countries, and part of that has to do with the challenges around measuring child abuse and domestic violence. We don't have good baseline data on child abuse, so it's hard to say how much did it increase exactly. There's some good studies at a country level, and the scholars are still working on trying to estimate this, but we actually don't have a good baseline for child abuse around the world. Similarly, with intimate partner violence or domestic violence, there's one meta-analysis, mostly based on studies in the United States, that show that it increased by 8% during the lockdown period in 2020. But currently, we're not able to triangulate or validate an original model estimate that suggested that domestic violence cases would increase by 31 million around the world over a 6-month period in 2020. COVID policies impacted intimacy, including sex and fertility patterns. Qualitative reviews, so reviews of interview-based studies, show both positive and negative influences on intimate relationships. In general, they do show an increase in gender inequality as women took on more care burdens at home and had to balance new work-life responsibilities. There was a consistent reduction in female sexual activity in 2020, and there's a surprising number of studies on this particular issue, including even an increase in sex toys and pornography as people sought pleasure alone rather than with loved ones or intimate partners. And one consequence of this general disruption to intimacy is actually on the birth rate. So there are a number of studies, mostly focused on Europe and also the United States, showing temporary reductions in the birth rate at certain time periods during 2020 and 2021, and even 2022, including a 14% reduction across 24 European countries in January of 2021. Another study found a general reduction of 4% in the birth rate across Europe in 2020. Now, there were many concerns by UN agencies early on that the recession accompanying the lockdowns and NPIs would increase unwanted pregnancies in low and middle income countries, and a number of models were constructed early on to estimate how many people would experience these unwanted pregnancies. And one particular model estimated 15 million additional pregnancies because of a reduction in reproductive health programs around the world. We don't have enough studies to be able to validate and explore the accuracy of these models. We have a variety of studies showing, for example, reductions in fertility intentions, especially in high-income countries. And in low-income countries, we do have individual country data showing an increase in unwanted pregnancies, but the exact proportion is not clear. And there's also some studies suggesting actually a decrease in abortion in Italy and elsewhere, for example. And there's also some curious data about early onset puberty increasing among girls during the lockdown period, and other effects on developmental milestones as adolescents reach maturity.
Hello, I'm Kevin Bardosh, author of this report. In the next video, episode 8, I'll be focused on how COVID policies negatively impacted community dynamics around the world. In particular, I'll be discussing impacts on social networks, stigma, mobility, crime and law, trust, mass protests, and impacts on media and elections. To watch this video, and all of the others, please do click on the link in the description below. And if you like, subscribe to this channel for regular updates from me and to learn more about the work we are doing here at Collateral Global.